there, welcome back to the show. So, a couple episodes ago, I promised that I would speak about histamine. And some of you may be thinking, what does histamine have to do with perimenopause? Well, besides allergies, which is what most people think of when they hear the word histamine, there are many more symptoms associated with histamine overload or histamine intolerance. And not surprisingly, your hormones play a role. So, let's dive in. Histamine is an important chemical that is crucial to the health of your gut, your brain, your nervous system, and your immune system. It is the immune signaling protein that is produced by mast cells. So, mast cells play a role in how your immune system responds to things like bacteria, parasites, mold, allergens, fragrance, and even stress. And essentially, they create an inflammatory response in the body. Now, histamine should be getting cleared out of your body with specific enzymes. We need histamine, but we don't want too much of it. And if you are somebody who has chronic inflammation, you drink a lot of alcohol, you have food sensitivities, or an imbalance of gut bacteria, that can affect how histamine gets cleared out of the body and in turn can develop into histamine intolerance or sensitivity. So, certain foods contain histamine, and some will cause us to release more of our own histamine from those mast cells that I mentioned. So, alcohol is a good example of this because it contains a lot of histamine, so that causes our bodies to release even more histamine. If you notice that you drink wine, for example, and you feel lousy after it, this could be why. Another thing to consider is you may be completely fine eating foods that are freshly cooked, but if you store them as leftovers and eat them like a couple of days later, you may have a reaction, and leftovers do contain more histamine. So, in a healthy and diverse gut microbiome, dietary histamines are broken down by an enzyme called diamine oxidase, DAO, DAO. However, in a less diverse or imbalanced gut microbiome, which is so common nowadays, DAO activity may be too low. So, you're going to have a hard time clearing out that excess histamine. So there are other reasons for this as well, like SIBO, that's small intestinal bacteria overgrowth. If you have a vitamin B6 deficiency, if you don't have enough progesterone on board, which we'll talk about in a bit, or even if you have used hormonal birth control, which so many women have, these things can also contribute to histamine intolerance or sensitivity. So, unfortunately, like many things, histamine intolerance is poorly understood in conventional medicine and it's rarely acknowledged. So, you may be somebody who has had chronic symptoms for years and you're just not getting anywhere with, a regular doctor. And of course, unfortunately, it is more common in women than men and it tends to be worse in midlife, as if we need anything else to worry about, right? So let's talk about some of these symptoms that are associated with histamine intolerance. So I mentioned allergies, and histamine intolerance can mimic allergic reactions. So things like hives, skin rashes, itchy skin, flushing, even IBS-like symptoms like diarrhea or loose stools. Some people experience acid reflux or indigestion, but some other things that you may not realize are tied. Nasal congestion is one of them, so that's kind of like allergies, but also things like dizziness, shortness of breath, heart palpitations, anxiety, brain fog, migraines or headaches, intense menstrual cramps, joint pain, which is something that I dealt with, and insomnia. So histamine is very stimulating. So that can keep you up at night. That's why a lot of people struggle with sleep. So you're probably wondering, well, how are hormones connected to all this? And some of those symptoms that I mentioned definitely have to do with hormone imbalances, but this is another piece, right? The body is so complicated. There's so many moving parts. It's never just one thing, right? Yes, our hormones play a massive role in this stage of life, but so does the health of our gut, as well as a number of other things. So how specifically are hormones connected to histamine? Well, an excess of estrogen, or my preferred way of saying it is unopposed estrogen, can cause you to overproduce histamine. So estrogen stimulates mast cells. So the higher the estrogen in the body, the higher the histamine. And too much histamine is going to increase estrogen, because histamine stimulates your ovaries to release more estrogen. So it is a bit of a vicious cycle. And estrogen itself stops that DAO enzyme that I mentioned from working really well. So if you are intolerant or sensitive to histamine, you may not be able to tolerate your own estrogen very well. And in your 40s, estrogen, as you know, starts to fluctuate wildly. And at times, it can be the highest it has ever been. So you will have more of those histamine releases, right? And that, of course, is going to result in more symptoms. And they're going to be more noticeable in this stage of life. And obviously, that's why a lot of women are coming to work with us, because perimenopause kind of sucks, right? You have a lot of symptoms, like I mentioned earlier. Now, progesterone, on the other hand, is something that we need not only to balance the effects of estrogen, but we need it for a multitude of health benefits. But it's also known as a mast cell stabilizer. So it has an anti-histamine effect and in turn decreases inflammation. But as you know, as I mentioned many times, in our mid 30s is when progesterone starts to decline rapidly. And this is another reason why I believe many women would benefit from progesterone hormone replacement therapy, even as early as their 30s if necessary. Mast cell secretion may be regulated by progesterone, and it may even explain the reduced symptoms of certain inflammatory conditions during pregnancy. So as you know, when you're pregnant, your progesterone is quite high. And during that time, your body is smart, right? It develops a way of protecting your fetus from excessive histamine by increasing the amount of DAO, that enzyme I mentioned earlier, and that helps to break down histamine more efficiently. So some other hormones that are tied to this are testosterone, as well as DHEA and cortisol. And when they're really high, that can trigger histamine release. So, this can be problematic because, there's women who have PCOS, for example, when testosterone or your androgens are elevated. And even in perimenopause, we may have a surge of testosterone before it eventually declines. And as you know, and as I talked about before, cortisol is our stress hormone, and we are more stress reactive in this stage of life. We are all under so much stress nowadays. So when that cortisol is high, it is going to have a downstream effect in so many ways, but it is also going to trigger that histamine release. So if you needed more proof or encouragement to do more self-care, set more boundaries, there you have it. Okay. You really do need to do your best to manage stress in this stage of life. And that is both physical and emotional. And I've talked about the difference between those on prior episodes. So go back and listen to them. All right. So the other thing to think about is in this stage of life, as you know, I'm a big fan of hormone replacement therapy. I believe that most women should consider it, have that conversation with a trusted provider. However, when some women start HRT, they may feel worse. Now, there's many reasons why you may not feel good when you start HRT. It could be that the dose isn't right for you. It could be the type, the application. If you're cycling it, maybe that is or isn't working for you. But it can also be due to a histamine sensitivity or intolerance. So, of course, it's important to adjust your dosing, the type, accordingly with your provider. But you also want to make sure that you have ample progesterone on board and you approach histamine intolerance from a functional health approach, which I'll talk about in a second. But what I want to just talk about really quickly is that progesterone piece, because I hear this time and again from clients and even women just in my community, where they say that they'll go to their doctor or their provider, and oftentimes they will just recommend estrogen hormone replacement therapy. And obviously I'm a huge fan of that. I love estrogen, but I do believe that giving a woman progesterone as well can be so supportive. And like I said, because of the fluctuations in estrogen, and then you're adding more estrogen in, which yes, can help mitigate those fluctuations, you still want that progesterone for all of its protective benefits, as well as mitigating this histamine release. So make sure that your provider is knowledgeable and understands the benefits of progesterone that go way beyond just protection of the uterine lining. This is how we approach it with clients. One of the things that we do, of course, is we prioritize gut health optimization. So we're all about your gut health. We talk about managing inflammation, removing certain foods that are triggers or common allergens. And of course, we do give our clients access to a comprehensive stool test, which is known as a GI map. That's going to give us insight into not only histamine producing bacteria strains, but it's going to give us insight into the overall health of your gut microbiome. So if you have an imbalance of gut bacteria, if you have any inflammation, if you have something called H. pylori, which also can affect your histamine, and so on. So it's really important to address your gut health. The other thing we focus on with clients is opening their detox pathways, making sure they're pooping, they're sweating, they're breathing properly, supporting their lymphatic system. It's really important to support detox on a daily basis, not just doing a detox here or there once or twice a year. You don't need to do something super intense. You want to be supporting that on a daily basis. And these are practices that we teach our clients via food, lifestyle, and yes, some supplements when necessary. The other thing is we recommend for clients who have a bunch of symptoms like this, and quite frankly, most of our clients are coming to us because they have chronic symptoms. They have, more than one that they're dealing with, and they are really life altering. So for some of them, we will recommend a short-term low histamine diet. And then of course, targeted supplementation based on their needs, and the education to consider hormone replacement therapy. So let me break it down a little bit further and then I will wrap it up. So, we have our clients track their symptoms. It is really important to note when you are feeling your worst. And yes, your perimenopause periods are all over the place. They are unpredictable. They can be irregular. But what we find is a lot of our clients are still cycling pretty regularly so that they could track more or less, and they can use like a period app or tracker, one of those things, to just note like what the symptoms are, when they're noticing them. Is it day 13? Is it day 11? Whatever. And that just helps us to better guide them to really understand what's going on. So for most women, these histamine symptoms are tied to estrogen or the estrogen fluctuations that occur. So in a menstrual cycle, let's just say it's a regular 28-day menstrual cycle, the day one is the day that you bleed. During that time, your progesterone and your estrogen are pretty flatlined. Like, you're not making much, right? And that's when a lot of women actually feel pretty good, besides if they're having cramps or whatnot, but they don't really have a lot of the histamine-like symptoms. But towards the end of their period, when their body is getting ready for ovulation, that is when estrogen starts to rise. And like I mentioned earlier, that is when histamine can start to rise. So a lot of women will start to feel really lousy like day 9 or day 10 of their cycle. And then things start to kind of even out because their progesterone hopefully starts to peak, but then they do get another spike in estrogen, and that's when they start to feel pretty lousy a little bit before their period. And then your hormones start to decline again to get ready for your period. As you know, in perimenopause, a lot of us are having anovulatory cycles where we don't ovulate. So we're not making robust amounts of progesterone. So you can feel pretty lousy in the second half of your cycle. And we do suggest a short-term low histamine diet. Now, this doesn't mean that you remove all histamine-producing foods. We're not fans of really restrictive diets. We're more fans of adding things in. Foods that are going to support your body in this stage of life. They're going to support your hormones. They're going to balance your blood sugar. However, there are some common allergens and some foods that can be problematic based on our client's health history, symptoms, and so on. So we will recommend removing some things. Now, we give our clients a chart that shows some of the foods that are higher or highest in histamine. And if they see that there are any on that chart that they tend to consume a lot of, we will recommend that they remove them for a little while as we work on their gut health, as we open detox pathways, as we support them nutritionally and via supplementation. Now, some foods that are high in histamine are things that are actually pretty healthy. And this is why a lot of people get really overwhelmed because they're like, I don't get it, Claudia. I'm eating really healthy foods, but I still have all these symptoms. Well, things like fermented foods can be high in histamine. So think like kombucha, vinegar, yogurt, kefir, I always say that wrong, sauerkraut. These are all things that are pretty good for you, but because they're fermented, they're higher in histamine. So that can trigger that histamine release. Beer is another one, which I don't think many people are drinking. I hope not, because there's gluten in there. It's just not great. And of course, that can trigger histamine. Dairy is another one. Smoked fish, Processed deli meats can be problematic. Some nuts and seeds, not all of them. Citrus fruits like lemon, grapefruit can be a problem for some people. Chocolate, which is just the worst because like I love my chocolate, but when I have had histamine flares, I have had to minimize the amount of chocolate I was consuming, and even leftovers. And then some other high histamine foods that can be problematic, again, are some things that are healthy, like avocado, pickled foods like pickled beets or pickles or olives. Like those are like some of my favorite things to eat. But yeah, they can be problematic if you have a histamine sensitivity. Canned foods are another one. Shellfish, dried fruits, strawberries, pineapples, and even papayas can be a problem. All right, so let me just quickly go over some over-the-counter stuff and supplements, and then I will wrap it up. So some people will take over-the-counter antihistamines. I am not opposed to this because if you are dealing with an acute histamine response, you may feel lousy. So having an antihistamine on hand is a good idea. Ideally, you wouldn't take these long-term. We have had clients come to us taking antihistamine for years, and that could be problematic, like I said earlier, because you don't want to lower your histamine too much. We do need it. We just don't want too much of it. You want to address the why behind it. Why is this happening? Why are you having all these immune responses? Another thing you may find relief from is Pepcid. So that is also over the counter. That is known as an H2 blocker or histamine blocker. What it does is it reduces stomach acid in the gut, and that is made in response to histamine. You may notice pretty rapid relief from your symptoms. And then in terms of some supplements, and these are general recommendations, I don't know if they're going to work for you. We have found success with clients, but again, we test, we look at their overall health history, we look at their symptoms before we make recommendations, but these are just some that are known to help with histamine. So vitamin C is one of them. However, you don't want to go too high dose because, like I mentioned earlier, citrus fruits, like that can be problematic. Typically, you're going to want to start with the low dose and see how you do. And I wouldn't throw a bunch of supplements in at once because you could react to them. So do one or two things at a time and just see how you do. Dow supplements are another one. So I mentioned the Dow enzyme earlier. A brand that I like is Seeking Health by Dr. Ben Lynch. And these are typically taken before meals to reduce a response to histamine. Some other things that we give to probably most of our clients are B6 as well as magnesium. These can be really helpful because they both inhibit histamine release. And then two other ones to look into are quercetin and bromelain. So those also have antihistamine, anti-inflammatory properties. They could be really helpful. Some people take them just for allergies, but they can also be helpful for these histamine-like responses. All right, all that said, I know that it can be a little overwhelming. I covered a lot, but this is why we do what we do. The Hormone Rescue is currently closed for the month of June. However, we are making some updates behind the scenes that I'm really excited about. I'll talk more about that in the coming weeks, but we are going to be reopening in July. So make sure that you get on my email list. I will put a link in the show notes. So you do that, and then you will be notified of all the updates, the pricing, the payment plans that we have, as well as some special bonuses coming your way. All right, I hope that was helpful to you, and I will see you next week. The information provided is for educational and informational purposes only. I am not, nor do I act as a doctor or any other medical professional. I am not providing healthcare, medical services, or attempting to diagnose, treat, prevent, or cure any physical, mental, or emotional disease or condition. The information shared is not intended to be a substitute for the professional medical advice provided by your own medical or mental health provider.